Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program for tonight Dr. Amrou Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine in Ain Shams University. Thank you very much for being with us tonight on the Daily Debate.
It's a great pleasure. Thank you.
Pleasure is all mine, and a Happy New Year as well.
You too.
Of course, Doctor, we've had, inshallah. Of course, we've had a year full of presidential initiatives, for example, regarding the medicine and the medical facilities and the medical initiatives that we have seen over 2024. How do you see the past year in terms of this field, as this is one of the main priorities for President Abdel Fattah al-Sisi, for Prime Minister Dr. Mustafa Madbouri, for the political leadership in general, for the benefit of the Egyptian citizen?
You see, as always I say that the most important investment, especially in a country like Egypt, which has one of the youngest populations in the world,
yes,
we have to think of that as an asset, not as a burden. Yes, we can definitely aim through the organization of the population, and especially in decrease the number of family members through contraception measures. This is one of the pillars of real good growth. But to talk about the amount of population, of the young population that Egypt has, which forms maybe more than 30% of our population in the age of the young age, from 18 to 30 years, this gives us a real tool for the future. And the investment in two things of these pillars, which are the investment in health and in education,
yes,
is the most important thing. We can see this through the experience of other countries, and especially, for example, Japan. After the devastating World War II, we saw that the investment was in education and in healthcare. The same thing happened in Vietnam. Vietnam in 1986 has seen the great, there was a threat of famine, there was an epidemic of tuberculosis, which is one of the oldest illnesses to happen, and to happen in the late part of the 20th century was a great catastrophe,
yes,
in a young populated country like Vietnam. And so from this onwards, they concentrated on education and health. And Egypt has been concentrating on the health programs ever since 1960. But it had a strong push in the past 10 years during the tenure of President Sisi in saying we have to improve the health care. And this has to go hand in hand with education. When we're talking about health care, we have also to talk about the second arm, which is education, and,
yes,
and especially in medical education. We need expert physicians. We need to transfer the expertise of the senior members of the medical corps to the younger generation, who are going to carry the pole of the flag for the next 30 or 40 years. The investment in this education is very rewarding. The progress in medicine with the AI and with the things like that is one, and the robotic surgeries and the robotic medicine cannot interfere with the role of the human factor. And the investment in the human factor is the most important thing. We have had, and we have started to have modern physicians since 1828,
yes,
with the inauguration of the medical school of Qasr al-Aini. Originally it was in Abu Zabal, and later on transferred to the Qasr al-Aini, where it is right now.
Yes.
So when we talk about this investment that has been done for the past 200 years, almost 200 years, we're not starting from scratch, but we are in the part, or in the part of our life is in the polishing up of this service, investing in the human being, investing in the doctor, investing in the assistant doctors, investing in the supporting staff, whether these are the nursing medical corps or the technicians in the laboratories or in the radiology departments or in the physical medicine departments. All these we need polishing up of their skills, improvement of their educational programs, and definitely improving the incentives that are given to them.
Yes, Dr. Amrou, I would like to focus on the education of the doctors and investing in the doctors and the medical staff in the years to come, especially that we have seen many statements by President Abdel Fattah al-Sisi regarding this important topic. But how do you see the importance of elevating the quality and the standards of the services given to the patients first?
Well, the patients and the doctors are a part of the same team.
Yes.
The doctors are very important in this particular team because one doctor can give a service to more patients. And we know that the problem in Egypt is that the number of physicians are lesser than the international standards.
Yes.
The international standards should be we should reach the international standards. We should increase the number of physicians, and we should not increase just the quantity but the quality. And the quality necessitates increasing the academic background of the physician and his clinical skills. And that's why there has been a modification recently in the Faculty of Medicine. For example, when I started studying medicine back in the 80s, they were having a preliminary year in the Faculty of Science and 6 years in medicine. 2 years of them are clinical and 3 years are in the academic arena. So they're almost 4 years academic and 2 years clinical. As time progressed, we are now seeing that there will be the academic scholastic years are 5 years in the whole Faculty of Medicine, including 2 years from the very early start clinical attachment to the hospital, and before he gets his final certificate, he stays for 2 years as a house officer. And the house officer, for sometimes in the beginning of our lives, it used to be a period that was full of minimal education and a lot of chilling in the good weathers, whether it is in the sun or in the cold weather, in the sun or in
due to the conditions
that
are being present. Yes.
But things are gradually changing. The dependence of the medical system on the house officers and increasing their year of work from 1 year to 2 years is a great achievement because we didn't increase the number of years. They are still 7 years, but 2 years of them are he's a fully graduated doctor. He didn't have his full license yet, but he is practicing under the supervision of his more senior colleagues. And this is one of the most important steps. He's applying under complete supervision what he has learned in the past 5 years. I think this is an important step forward. And let me talk honestly about the standard of the Egyptian physicians. It's a very good and very high standard. We are talking
it competes globally.
Yes. We are talking about A-star students who graduated from the Sanawiyya Amma or from the IGCSE or whatever the system that they studied, enrolled in medical school for 7 years. They are full of discipline, they are full of hopes, and they are carrying a lot of empathy in themselves. And they have great empathy towards the patients. And as I always tell my students in the Faculty of Medicine, you are the top notch of the schools. And the top notch means that your IQ is very high and your self-discipline is very well established. And it's your role to search for information and to keep it and go on searching for it. And we have found out that the number of young people enrolled in the medical schools all over the world is on decline because it's a very demanding job. And I say that the life of a physician is not time-consuming, it is life-consuming. When a physician starts his work as a young physician, he carries an oath that he will always abide by all through his life. He's taking care of this oath and keeping always the interests of the patients even before his own interests. A physician is the first line of defense against illness. It is the first line of defense against injury, and he is definitely the first line of defense against death. And therefore the role of physicians is and always will remain an important pillar of the society. And going back to the education that our physicians are having, which is a high standard of education that makes European countries have exemption from the equivalent. They don't sit now anymore for the equivalence of an exam. They are allowed to be integrated from day one in a lot of countries.
With the same degree from here.
With the same degree from here, for example, like Germany. And in Germany, they accepted them with a higher skills in the German language. And nowadays, due to the need to the physicians, they even have reduced these skills and tell them, come and we're going to improve your German language as we go. because we need good physicians like you. And this is in all Europe, and nowadays even the Egyptian physicians have reached Japan. Imagine that. So we are having what should we say, a bleeding or a hemorrhage of or a brain drain or a physician drain in our country. And I remember that our national carrier is having now, instead of 1 flight per day to London, we have 3 or 4 flights per day to London.
For doctors.
For the physicians and their families. So it's very important to understand how these physicians are carrying the Egyptian flag high, and how their heads are high in these countries, and how we are losing some of these physicians to other countries. Yes, it's very nice to know that our Egyptians are doing and faring well and excelling, not just in Europe, not just in the States, even to Japan, Australia, New Zealand, Latin America, name it, and you can find Egyptians working as physicians even in Africa and in the remotest parts, not to mention, of course, the Arab world. So with this important human resource, this important person as an Egyptian physician who is following the footsteps of Imhotep, the first physician in the world who was an Egyptian. Definitely we have to appreciate them, we have to give them more skills, we have to give them more incentives, and we have to ask them, please don't go.
Yes, I would like to focus on the doctors. I would like to concentrate on the future of them in the country and the medical staff as well, because we have seen several statements made by President Abdel Fattah al-Sisi regarding this important topic and the future of doctors in the country. How do you think we should be saying to them, please don't go, as you mentioned, because we have seen over the past, I wouldn't say 10, 20, 30 years, the hemorrhage that you've mentioned in the human resources of the physicians. They go out to Germany, to Europe, to the NHS in England, in the United States. What makes them leave? Is it the money? Is it the life standards? Is it the quality and the services being provided by the health provider to the citizens in Germany or in England, for example? What makes them leave in the first place? Especially that you mentioned that they have discipline, they have hopes, they have dreams, but they have disappointments after being graduated.
It's multifactorial. Let's accept this idea, and it's job of us as professors, and the job of the government is to attract these physicians. We have to embrace them. We have to embrace their dreams, and we have them. We have to consider them as part of our pride and of our joy. To have a young man or a young lady who have decided to dedicate their life to the service of the community. And they are serving people. They are serving human beings. And every day you can see a physician who's rapidly going around the hospitals, different hospitals, even if it's a free hospital or a university hospital, and going fast as he can to save lives, to deliver a lady who is in agony, to help to suture a wound, or to help to repair a wound, and to yell for help when he needs help. We have to be standing by these brilliant people who defended our country during the COVID, and we have lost a lot of martyrs in this battle, and which was definitely a battle that we didn't lose. We won. We lost some of our best staff members. We lost a lot of our colleagues and our friends who succumbed to COVID, and yet they still carry the flag high of the Egyptian physicians. And for them, we always can salute them, because they are the ones who are in the front.
But it is a very demanding job, as you mentioned, doctor, as well. How can we be turning it into a rewarding job? They get the rewards at least at the end of the day.
Well, it is a demanding job.
Yes.
And any medical student, when you ask him why did you go to medical school, you can go and count them, but you will always count in the number or the respect that the people show to the physician, whether these are in soap operas or this is in different television programs or whatever. The respect that has pushed them to go to medical school, and this enthusiasm we have to nourish and nurture, always to stand by their sides. and trying to fulfill their dreams. What the physician needs is not just money. What the physician needs is appreciation. What the physician needs is a lot of resources and a lot of education.
But don't you think that socially they get the appreciation that they need or they want, especially throughout the past 4 or 5 decades? To be a doctor in Egypt, that's a big thing. But on the financial level, that's a big difference. That's a big problem.
Definitely, definitely. And that's why in Europe and in other countries, the physician's job are not as glamorous as it used to be. Nobody likes to work long hours with minimal wages. And in Egypt, we are having long hours of work and yet minimal wages, but people are accepting to do this job. And for them, we should appreciate them. We should give them more care and more respect. They are trying hard, and you can never hardly find a physician who doesn't or is not willing to sacrifice his time, his health and his efforts to save lives.
Yes. On the other hand, and my last point for the physicians and for the doctors, you mentioned that they have empathy, even the graduates, the newly graduates and the fresh graduates, they have empathy towards the patients, of course, of Egypt and whoever is getting treatment here in the country. Is this a point of weakness or a point of strength?
Well, there is a big difference between sympathy and empathy. Sympathy is that when you see a poor man, you say, oh, that's a poor man. Empathy, when you walk in his footsteps or you walk in his shoes. And empathy is one of the greatest emotions, that if a person has it, then he or she are very honorable people.
Yes.
And honor, they say, for example, a famous Arabic saying that says that when a person dies, his money and his family will leave him, but his honor will always stay beside him. And so honor is empathy. Honor is the word of honor that you have taken as an oath on the first year of becoming a physician, that you are here to save lives, that you are here to protect and to secure and to give hope. This is the role of a good physician. Empathy is the sentence, not sympathy.
Yes, Doctor, allow me to be going to the other report of the daily debate for tonight, focusing on the main topic and what we have been talking about throughout the episode for tonight with Dr. Amr Mabrouk, which is the investment in the human and the social development of the country. And Egypt highlighted 118.3 billion Egyptian pounds over the past period for this investment and for this development. We'll be having more details in the upcoming report. Stay tuned.
Minister of Health Khalid Abdel Ghaffar announced that the Egyptian government has invested approximately 118.3 billion Egyptian pounds in human and social development initiatives for 2024-2025. Abdel Ghaffar said the advancements in Egypt's healthcare system included the Universal Health Insurance Program and the extensive modernization efforts over the past decade. Egypt has doubled its healthcare budget in recent years, directing funds towards hospital infrastructure and healthcare facilities nationwide. Total investments in the health sector from 2014 to 2024 reached 1 trillion Egyptian pounds, with the Universal Health Insurance Authority receiving an additional 240.5 billion Egyptian pounds. Phase 1 of the Comprehensive Health Insurance Initiative was implemented with a budget of 51.2 billion Egyptian pounds, with preparations underway for Phase 2 involving several governorates at an estimated cost of 120 million Egyptian pounds. The minister highlighted the success of presidential initiatives aimed at public health, which provided over 170 million healthcare services to around 94 million Egyptians. Among these, the newborn hearing screening covered over 6.8 million cases, while the Women's Health Initiative has seen over 52 million visits since 2019. Additionally, Egypt has undertaken numerous infrastructure projects with 1,219 healthcare facilities either completed or in progress, including several major hospitals and medical centers across the country. Egypt's health initiatives also emphasize addressing population growth and promoting family planning. Through the Golden Thousands Days program, 15 million families received counseling services supported by 1,500 consultation rooms throughout Egypt. Efforts to raise awareness of child rights and spacing between births are ongoing through local campaigns and the National Population Council's efforts across all governorates. The ministry's New Start for Building Human Potential program, part of a broader initiative in human development, focuses on delivering integrated services in health, education, and employment. This initiative has already provided over 55 million services, including health clinics, job training, and nutrition support to all age groups up to 65 years in cooperation with 30 partner organizations and over 9,800 representatives nationwide.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program Dr. Amrou Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine in Ain Shams University. Thank you very much once again for being with us tonight.
It's a great pleasure, sir.
The pleasure is all mine. We have spoken about the future of doctors, the future of physicians in Egypt in 2025, and hopefully for the better, for the benefit of the citizen, for the benefit of the patient, and for the benefit of the doctor and the medical staff as well. But on the other hand, how do you see the presidential initiatives that we have seen over the past 10 years, like 100 million healthy persons, 100 million health, 100 days of health as well here in Egypt? How do you see the success, and how would you assess the achievements of those initiatives?
This is definitely a great success and a great advance and a great step forward. We know that in the 1960s there has been the project of building central hospitals and health units all over the 4,000 villages of Egypt.
Yes.
And these health units have done their job, which is a miracle that has improved the expectancy of life in males, in Egyptian males, to 73, and Egyptian women to 74.
Yes.
This, in comparison to 54 in 1960, this is a great advancement, and it's a great step forward, because these units were supplying two simple things. They were supplying pills for the diabetes and pills for hypertension and treatment for bilharziasis and some management of fertility and infertility.
Yes.
And this progress was hampered by the 1967 defeat, hampered by the great increase in the population, and hampered also with the economic stress of the preparation of 1973 war and onwards. And of course, at that time, the political leadership was not that concentrating on the field of healthcare. With the advent of President Sisi, he started to take care of this step. And this is taking care or bringing improvement, the quality of life. Yes, the expectancy of life did not increase more than 74, which is not important. What's important is the quality of life. From people who were just concerned to take the pill of the hypertension if they feel headache, or the pill of diabetes if they are going to the toilet frequently, to people who know that they have to take the pill of hypertension every day, or that they have to control their diabetes every day. And this was through the propagation of information by these existing units and the central hospitals, who have really advanced or made a further step. The second important point was the presidential initiative in the waiting, or reducing the number of patients in waiting lists, and supplying the hospitals with their needs, urgent needs, for maintaining or for shortening this waiting list. We know that the waiting list is always the nightmare of any NHS system all over the world.
Yes.
And we have the oldest NHS system since even the ancient Egyptians.
Yes.
So for us, the NHS system is something that goes beyond competition. We have to cover that. The presidential initiative of making the NHS cover the whole world, starting in Port Said and Ismailia and going further towards the capital, is a very great step and a very ambitious step. This is something to be complimented. Of course, getting rid of the infective hepatitis, or hepatitis C, it's a miracle that we never thought that will happen, and we never thought that we'll see it in our lives. We have been raised for the past 30 years that hepatitis will eat up the livers of Egyptians. And nowadays, this miracle treatment and the concentration on doing that is another step. The 100 days and the 100 million health and taking care of exposing or knowing the chronic illness or combating the tuberculosis or attacking the different ailments such as cancer breast and the check of the hearts and controlling. When somebody told me that he was surprised that he had a chest pain, went to a free hospital and was admitted to the emergency catheterization and has a new life for free.
Yes.
This is something that you can hardly find anywhere in the world except with a very expensive insurance that this person is paying, even in very highly advanced countries like, for example, the United States of America. So this is what we can call a great advance. Yes, we need fine-tuning. Yes, we need extra care. Yes, we need to concentrate on the weak points in this system, but we cannot deny that this job has been done miraculously in merciless situations, in merciless economic conditions, and at the same time in severe turmoil surrounding us from all worlds or all our borders. So this is something to compliment upon, but this is something to build on, something to get more advanced and reach even more the needy people and supply them with their demands and with their needs. As we go further forward, as we go onwards, we need more hope, we need more things to stop despair, if we may use, and to combat despair.
Yes, Doctor, you mentioned the importance of the comprehensive health insurance system that was applied here in Egypt, starting with 5 governorates, Ismailiyah, Suez, Port Said, Aswan, and Luxor. Of course, we are waiting for the later stages and the latter stages of this program, reaching Cairo and Alexandria.
That's the big challenge.
Yes.
We have to know that, of course, Cairo is now, or Cairo Governorate with Giza affiliates or something, are approaching 20 or 25 million people in the 3 governorates, Cairo, Qalubiyya, and Giza. Yes, this is a big challenge, but we cannot...
How much time do we need to be going there?
We have to reach there yesterday. As the President always says, we have to be there yesterday. Like when for example, like when a patient asks me, when should I stop smoking? I tell him, yesterday.
Yes.
So yesterday is not that far away to start. Yes, we need a lot of concentration on these fields, and we are hoping that these steps are going on further, and especially in family planning as well.
And you've mentioned the elimination of the waiting lists of the critical surgeries, which is one of the presidential initiatives and one of the presidential directives by President Abdel Fattah al-Sisi. Do you think that this is in the favor of the patients, just the patients, or in favor of the doctors and the physicians and the medical staff to be having more training over the years?
Well, yes, this is apparently this could be the thing, but we have to know something. Nobody is allowed to play or train on patients. And this is sometimes is a misinformation that reaches the patients. I've seen a young doctor operating on me. No, this is not true.
Yes.
There is always a guiding hand. There is always a godfather. There is always somebody patronizing the relation.
But a young doctor could be a good doctor.
Yes, of course. But this good doctor is fully supported by a senior man with him or a senior lady with him, who are taking his hands through the uncharted waters and the uncharted seas.
And we have seen one of the developmental initiatives, not just for the health and the education, which is the Decent Life initiative, covering thousands of villages all over Egypt. I think 5,000 villages, with the first stage and the second stage being implemented nowadays of the Decent Life initiative. One part of this initiative is to be focusing on the medical centers, the hospitals, and the health units in those villages. How do you see the importance of having quality services with higher standards at 5,000 villages all over Egypt through the initiative of the Decent Life?
4,000, as far as I understand, they were 4,000. Anyway, when we talk about that, we have to say that the most important point that will definitely make a difference is the personnel. The presence of dedicated people behind this initiative, which goes sieving from the leadership of the country as it sieves to its way to the poorest of these villages.
Do we have the numbers needed of the medical staff?
I hope we have. I hope we try. I hope we go on and try to find them and fetch them and keep them, because they are our fortune and they are our saviors in the coming days and years.
So right now we don't have this number needed.
We need more. We need more physicians. We need more physicians to reach the number of the estimated number of physicians, which is 1 to 400. I think we are now 1 to 10,000 or something like that. This is
that's a big
the
gap.
number of physicians has been reduced recently. 7,000. We lost 7,000 physicians in the past year or two or so. So it's important to understand the problem. When we know that there is a problem and you accept its occurrence, then you can always proceed to solving the problem. And solving the problem is the way that Egyptians have been going through all their lives. Egyptians are problem solvers. They get accustomed to a problem, they go around the problem, they try to fix it, and definitely, inshallah, they will fix it.
Yes, and finally, Doctor, how do you see the importance of the role of the private sector in the universal health insurance system and the healthcare system in general here in the country?
This is a very important support. The private sector has been always glamorous in supporting or bypassing, for example, the waiting lists or whatever, or supplying a 5-star service as regards the residency of the patient in a hospital. People would ask for that. Why not? Give them the chance to have that. And if you want to apply for them taxes, no problem, because these taxes should go to the free medical sector to care for more patients who are in need of support. So always the support of the private sector will carry from the burden on the NHS system and keeping the NHS system working efficiently, actively and successfully.
Yes, all hopes for the upcoming year to be better and, of course, a bigger system for the universal health insurance system, for the healthcare system here in the country as well. Dr. Amr Mabrook, the Professor of Plastic Surgery at the Faculty of Medicine in Ain Shams University, thank you very much for being with us tonight.
It's a great pleasure, sir.
The pleasure is all mine, and a Happy New Year.
You too, and we'll always remain optimistic.
Yes, of course, for the upcoming year more specifically. And this brings us to the end of the daily debate for tonight. Thank you for watching, and I'll be seeing you tomorrow.